Well, thankfully, there's another new treatment for Alzheimer's disease. Yesterday, the Food and Drug Administration approved the medication Donanemab. You'll probably see it being sold by Eli Lilly under the brand name Kisunla. Joining us more to tell us more about it and how it works, I'm so happy to have back on the show Dr. Margarita Reyes from Bristol Health. She's also a member of the Alzheimer Association's Medical Scientific Advisory Council. Good to see you again, Doctor.
Good to see you again.
I know, glad to have you here and glad to once again be reporting good news for trying to treat this disease that for what I think upwards of 3 decades we've made almost no progress on, but here we are. Tell us about Donanemab, how it works, and what kind of promise this provides for patients.
So Donanemab is an antibody that clears amyloid from the brain, which is the hallmark of Alzheimer's disease. It changes the course of Alzheimer's disease by slowing cognitive decline and slowing the decline in the day-to-day abilities that one can perform at home and in the community.
Yeah, how much do we know, in terms of percentages, or how are they measuring the effectiveness of Donanemab? I can never say that right, Donanemab. I want to say Donanemab, but it's Donanemab, yes.
So there are certain tools that we use to measure cognitive function and also day-to-day abilities, but there's about a 30% slowing of decline in brain function and, again, in abilities to perform these activities day-to-day.
Is this for all Alzheimer's patients or just a certain subset of that population?
That's a great question. This only is indicated for the mild stages of Alzheimer's disease, whether mild cognitive impairment or mild dementia stages.
Okay. How does this compare and contrast with Leqembi? That's the other drug for Alzheimer's disease that was recently approved.
So both work on removing amyloid from the brain. There's some difference in the type of amyloid that they target or bind to preferentially. Lecanemab is given every 2 weeks, but Donanemab is given monthly. And Donanemab can be stopped after there's evidence of amyloid clearance from the brain.
Got it. Now, this next question might be a little in the weeds, but last time I tackled this, I knew they were able to see that the amyloids, those plaques, were lessened from the drug's usage, and there was every reason to believe that would lead to this increased functioning in patients. But, science, you got to be very rigorous in making sure you're not making assumptions you shouldn't make. And it looks like, can we now really sort of connect those two lines and make that pathway? Fewer plaques means fewer symptoms?
Yes, so for both medications, both lecanemab and Donanemab, the clinical trials indicate that the clearance of amyloid plaques translate to less decline, like I said, in cognitive function. And, it provides patients a longer time to be able to be at their best functional ability, whether at home or in the community.
Speaking of patients, what are some of your patients telling you about some of the treatments they've gotten and just how much it's helped?
So I've had patients on lecanemab at least for about a year or so, and most, once they receive a diagnosis of Alzheimer's disease, are eager to get these treatments started. Most of these patients took care of their loved ones, their parents, and they know that the alternative is inevitable decline. Most are reporting stability, some improvement, and others less decline compared to patients who are not on the treatment.
That is fantastic. Now, there is a downside, and it's often a downside we see with new treatments, the cost, right? A lot of money went into developing this, and, well, they're not doing this necessarily for free. What can we tell people about the cost of Donanemab?
So the company states that Donanemab will cost $32,000 per year. CMS will cover the treatment if the physician participates in a registry that aims to determine how these medications perform in the real-world setting. Patients with Alzheimer's disease deserve the opportunity to determine if an FDA treatment is right for them, much like patients with cancer, heart disease, or multiple sclerosis.
Yeah, so well, that's good if CMS, the Center for Medicaid Services, is able to cover some of these costs. So I guess last question, a large stage, just what does this mean for the dementia community, and what's the next step beyond this going to be?
So it's hopeful, definitely. It's a win. Yeah. This is another major advancement in the treatment of Alzheimer's disease. It's another option for an FDA-approved therapy. But most importantly, this is a medication that's only indicated for the mild stages of Alzheimer's disease. So that underscores the importance of early diagnosis and early detection so that patients can have the most benefit at the earliest point possible.
Yes, please keep that in mind. We've done a lot of reporting about the early stages of Alzheimer's disease, how to stop it, especially early onset Alzheimer's disease and other forms of dementia. So that's something we're going to have a lot more conversations about in the coming days and years. Dr. Reyes, thank you so much for taking the time to join us.
It's a
and like
pleasure.
I said, it's so good to finally have some good news. And the second bit of good news, like with Leqembi on this front now too. So here we go, guys. If you've got any questions about Alzheimer's or any form of dementia, you can call the Alzheimer's Association's 24/7 helpline. It's 1-800-272-3900.